Good afternoon, dear patients. Today we will discuss a clinical case of allergic dermatitis of the scrotal area. One of our patients who came to our clinic had redness and burning in the scrotal area, and of course, after watching things on the internet and imagining himself a doctor, he started taking various medications, including choosing antihistamines on his own. He also began to apply Furacilin, Miramistin and other medications intensively to the scrotum, as a result of which the scrotal skin became swollen, covered with blisters, and the scrotum increased in size by about 2 to 3 times compared to its normal size. Naturally, it started to burn very badly and so on. So he came to our clinic for help. He was diagnosed with allergic dermatitis of the scrotal skin. Blood tests were taken, a complete blood count, immunoglobulin E, circulating immune complexes, and eosinophil cationic protein. As a result, an increase in basophils was detected, as well as elevated immunoglobulin E and circulating immune complexes. The patient then underwent further examination by an allergist, which revealed, among other things, a food allergy and so on. Accordingly, for a patient with this diagnosis, the following treatments were prescribed: intravenous sodium thiosulfate, calcium gluconate, and ozone therapy. Then, a course of specialized anti-inflammatory medications were carefully selected, along with various digestive enzyme preparations. In addition to these, a strict and carefully managed hypoallergenic diet was prescribed for the patient, as well as the administration of intestinal sorbents, such as the commonly used smecta or enterosgel to aid recovery. As a result, quite quickly, in a short period of time, the scrotal volume decreased, the swelling subsided, and literally within 7 to 8 days, the patient appeared almost completely healthy and was discharged in an almost fully recovered state. This case shows that you should not try to play doctor yourself, and you should not attempt to self-medicate. We have an extremely large number of such cases, including those related to the treatment of sexually transmitted infections and skin diseases. Your interference only hinders, firstly, the ability to make the correct diagnosis in a number of cases, and, more commonly, actually harms the patient. These attempts to imagine yourself as a doctor and treat yourself. Indeed, there are a lot of resources on the internet that talk about diseases, but including our own resource and others, they are more aimed at helping you understand what should happen during a doctor's appointment. For example, a doctor, say a dermatologist or a dermatovenerologist, cannot make a diagnosis just by relying solely on their sharp eye. This is technically impossible. It is technically impossible to say what you are allergic to. It is technically impossible to determine how severe it is, whether you need this examination, and so on. That is why you need a doctor to resolve these issues, not the internet. The internet can indeed help in guiding the patient on where to go, which specialist to see, what is needed for that, how to prepare. For example, to come without having applied any medications, preferably on an empty stomach, and so on. Maybe even to refrain from urinating. So the internet is essentially a benefit that exists for you to help you prepare properly, but under no circumstances, especially if you don't have a medical education, should you imagine yourself to be a doctor. Therefore, with any rashes in the genital area, I would advise not to interfere, but first to get tested, preferably by a doctor, and only then to try any medications on yourself, especially if you're doing it on your own. If you need diagnosis and treatment for any rashes in the genital area, you can contact the dermatologists and venereologists at our medical center, paid KVD in Moscow. We have knowledgeable specialists who are engaged in diagnosing and treating various diseases of the genital organs. We look forward to seeing you at our clinic. Also subscribe to our YouTube channel and our Instagram channel. Thank you for your attention.